Hey guys, Dr. Childs here. Today we're going to be talking about one big reason that I think many of you are not feeling better. And we're going to talk about that one big reason. We're going to break it up into subcategories and I'm going to hopefully help explain it to you so that this issue doesn't happen in your body or during your duration of therapy. If you don't know me, I'm Dr. Childs. I'm an internist. I specialize in helping people treat thyroid conditions, hormone imbalances, and of course helping people with weight loss. But let's talk about our main issue today, which is the one reason that I think many of you are just not feeling better. And what this has to do with is I think if I could just put it into one category, that would be that I think many of you are using your supplements, your medications, and everything incorrectly. Now I'm going to focus specifically on supplements, and the reason for that is I just did a video on using certain therapies for Hashimoto's, and I talked about using CBD oil and pycnogonal and things like that. And I've had a number of people who will leave comments and they'll say something like this: well, oh, that didn't work. I tried it for a little bit and it didn't work for me. And I've been seeing this trend over and over again. I also, on the other hand, see other people who talk to me about the side effects and symptoms that they've been having when they use certain supplements. And I realize they don't understand these topics, because if they did, they would have a different outlook and they would be using their supplements in a different way. And so I want to apply this to the setting of supplements. But I also want you to understand this applies to medications as well. And I'm talking about prescription medications and other natural therapies. So when appropriate, I will also talk about some of the supplements here. So you can input any sort of supplement you want into this. So this could be like adrenal supplements here, and we'll talk about the problems that you could be having as you use those. You could insert LDN here, you could insert CBD oil, you could insert pycnogonal, you could insert whatever, but any vitamin or supplement you're using. These four things must be considered if you want to check that off the list and say, hey, yes, it worked, or no, it didn't work. And what you should understand is that while, yes, it is true that not all supplements and not all therapies will work for every single person, right? That shouldn't be a surprise to you. Hopefully all of you know that that's the case. However, if you're not giving it a good enough chance, you can't check it off that list and say, hey, I'm never coming back to this thing or this therapy again. And I see people do this all the time, and it's so unfortunate, because if they knew these things, they would know that they might even be on the right track, but they threw out the baby with the bathwater, and now they're on the wrong track, or they're heading in the wrong direction because of these issues here. So let's talk about these things. I've broken it down into four sort of categories here. The first category we're going to talk about is your dose. Okay, and again, we're applying this as supplements, and you'll understand why in just a second. But really, this goes for medications as well. If you're not using the right dose, how on earth is the thing that you're going to be using working correctly? It's not going to work for you, right? It's just not going to work in your body. Now, here's where things get confusing though. When you look at a supplement, it always has the recommended dose on it, right? So if you look on the back, it'll say, here, use 1 capsule daily, or use 2 capsules every single day. Even medicines are the same way. However, medicines, the one main difference about prescription medication is that their doses are changed. So if you look at thyroid medication, there's a 25 microgram dose, a 50 microgram dose, a 75 microgram dose, etc. But if you look at most supplements, it's 1 capsule or 2 capsules per day. So what gives? So medications understand this concept, or at least the pharmacists and the researchers who create medications, prescription medications, they understand this. Whereas the supplement makers, and I think the people who are using them don't quite grasp this. And so this has to do with dose. And so what I've done here is I've broken it down into 3 categories that you need to consider and figure out which category you fall into, so to help you understand what kind of dose that you need. So I have sensitive, normal, and I have supraphysiologic. Okay, I'm going to explain these to you so don't let it confuse you. But basically we have categories of people who are using supplements. And the category that you fall into will help you sort of determine what type of dose you need to be looking for. So instead of just using this 1 or 2 capsule thing, you might be somebody who needs half a capsule per day, or 1 capsule every other day, or 2 capsules per day, or 3 capsules per day, even though the dose on the bottle says 1. And if you have used only 1 capsule per day and you didn't get the results you wanted, you might have said, oh, well, this doesn't work for me, I'm throwing it out, forget about it. And that's really unfortunate, because it might have been that your dose was too high. It might have been that you didn't use it for long enough, which is duration, which we'll talk about in a minute. Or it might have been that you needed to triple the dose or half the dose or whatever, right? It just has to do with this dose. It's so important. And so I've broken this up into 3 categories that I want you to sort of identify which category you fall into. So the first thing I have would be sensitive people. And these are people who, again, you'll know if you're sensitive. I've talked about this before, but sensitive people always volunteer that information whenever I'm talking to them or seeing a patient or anything like that. They'll say, hey, I take everything I take, I react to, right? That's a sensitive person. And these type of people generally need a dose which is 25 to 50% of the regular dose. Okay, so if the regular dose is 2 capsules per day, a sensitive person is probably going to do better on 1 capsule per day. And that's really where they should consider starting. Again, that's not going to be on the bottle though. If you look on the bottle, it's going to act as if everyone's a normal person, so they're going to say everyone needs 2. But if you fall into that sensitive category, you would do better taking 1 capsule per day, or maybe even a little bit less. 1 capsule every other day, or 2 capsules every 3 days, something like that. You need to play around with the dose. So that's the first category, is the sensitive category. The second category would be those people who I consider to be normal, stereotypically, or physiologically normal. These are the people that, yes, they do. They just use whatever the standard dose is, and they do fine when they take it. Now, figuring out where you fit into the normal category or not is a little bit difficult, but I would say, maybe as a rough estimate, probably 60% of people fall into this, maybe 10% to 15% of people fall into that, and then whatever the leftover is, 20% or so. These are just, I'm eyeballing, or I'm just estimating these off the top of my head, but it would be something like that. Okay, so we talked about the normal. Then the third group of people would be those people who need supra-physiologic doses. And that means you're taking more than the recommended dose and more than what your body might need. And you might think, well, why would I need that? Well, some people, if you have hormone imbalances that are not physiologically normal, it's going to take an extra physiologic force to normalize it. Okay, so hopefully that makes sense, right? Like, think about it in this analogy. Imagine the keto diet. When somebody has diabetes, which means they have insulin resistance, you need to be particularly aggressive when you're treating that problem, which means you're going to drop your carbohydrates down as much as you possibly can, sometimes close to 0. Now, that's a supra-physiologic drop in carbohydrates of what your body would normally need. However, you're doing that to influence your metabolism and to influence your physiology in a way that you want. You're directing that physiology to help treat your problem. And the same thing is true with supplements. So you can take these supplements in a supraphysiologic dose, which is more than the recommended dose, and you can still get benefit from that. Now I'm saying here, they may need 200% or more of that recommended dose. So if the recommended dose is 1 capsule, that might mean those people need to take 2 capsules per day. If it's 2 capsules per day, maybe they need to take 4 capsules per day. Now this is particularly true of some autoimmune diseases and so on. I'm not going to get into the specifics of why I do this, but you should be aware that this is something that you should consider, especially if you're using supplements, and even sometimes medications, by the way. LDN is one of these. So some people will think about the standard dose of 4.5 milligrams for LDN, and yet there are people who need 1.5 milligrams of LDN and people who need 7 or 8 milligrams of LDN. But if you only go on that 4.5 milligrams, which is the standard stock dose that most people talk about, and you use it for a month or so, and you're like, oh, it didn't work for me. Well, no, you didn't actually give it a chance. You don't know where you fit on that spectrum. So remember, dose is very, very, very important. Probably one of the most important things that you should be aware of as you think about these therapies, especially the ones that I talk about. Again, this applies to all supplements you're taking: zinc, selenium, any of my supplements, adrenal supplements, whatever. Any supplement, you need to consider the dose. Number 2 is the duration of therapy. So I can't tell you the amount of people who think that they're going to take a supplement for 2 weeks and feel better. That's just not real. That's not realistic. That's not going to work. That's true of most medications as well, except certain medications which alter your physiology, like Adderall or something. If you take Adderall, yeah, you're going to notice the effects the same day. But if you're taking thyroid hormone, you're not going to see the effects of thyroid hormone typically for 4 to 6 weeks. And even then, you're not going to see the full effect of that thyroid medication. You're going to see some effect, some beneficial effect, probably by week 4, but it's going to take you maybe even up to 8 to 12 weeks before you start getting up to 80 to 90% better to feel 80 or 90% of the physiologic benefits of taking that medication. So you have to give yourself time. So I'd say here, whenever you're considering anything and whether or not it's working for you, you need to have a time scale of 3 to 6 months. If you're assessing something and you've only used it every day for 3 weeks or 4 weeks or even 5 weeks, that's simply not enough time, especially when we're talking about your hormones. Yeah, again, some things can work quickly. I do understand that. But many, many, many supplements and many natural therapies and many of the things that you'll hear me talk about, especially if they're related to the thyroid or treating estrogen, testosterone, progesterone, whatever, any of those hormones, insulin, leptin, etc., your time scale needs to be 3 to 6 months, not, 3 to 4 weeks. Much, much, much longer. And that's because it takes a little bit of time for your body to turn around. It takes that time. So you have to give it the length of time that it needs. And if you're going to stick to something, say you hear about something that I'm talking about, you think, hey, well, maybe I need to try that. If you do, you need to give it an honest and good effort and give it the right amount of time. Don't just take it for 1 month and say, yes, it worked, or no, it didn't, and then check it off your list and say, well, I'm never going back to that again, because it could have been that it worked, you just didn't have the right dose, or you didn't use it long enough. So remember, duration of therapy is incredibly important. Number 4, and this possibly might even be the most important, would be side effects of certain supplements. And this also applies to medications as well. Now, I don't know if this is said anywhere, because I haven't really heard anybody talk about this really, but you need to be aware that if you are on the right track, meaning you're taking the right thing for you and this is the thing that's going to help you get better, it is not uncommon for that thing to make you feel a little bit worse. I know that you wrap your head around that because and if you think about it, it makes a little bit of sense because it took you a long time to get to where you are. So if you have like, let's say a little graph here and you have your optimal health here, let's say you're not eating healthy, you're stressed, etc. So your health is declining, right? Your health is going down. Well, guess what? So all these things, and then you're right here, you hit rock bottom. Okay. So you're not feeling very good, but you think, oh, I want to get back up to, this area here. Well, guess what? You have to slog through all of the feeling unhealthy and feeling poorly before you get back up to feeling good again. And it's not uncommon for many of these therapies, and this includes medications. This is not always true of thyroid medication, by the way, but it can happen. But certain supplements will make you feel a little bit worse, but that doesn't mean that it's wrong for you. You're on the right way, you're in the right trajectory, and you're heading in the right direction of feeling better, but you sometimes have to feel a little worse. Okay, so now people say, well, why does this occur? Shouldn't I always feel great? Not necessarily, because we have to remember things like detoxification. So many of the bad things that are in your body are fat soluble, meaning that your body can't get rid of them as easy as it can other things which are water soluble. So water soluble things means that they dissolve in water. Your body can simply pee it out and it's just out of your body really quick. But fat soluble things, your body has a little bit more of a difficult time getting rid of them. And often it knows that they're bad, so it sequesters them or hides them away. And usually it hides them away in your fat cells. Okay, so guess what happens as you try to take therapies and medications to help reduce inflammation and to help you lose weight? All the stuff that's inside your fat cells are going to be released. And as it's released, those go into your blood. And guess what? Those are things that your body didn't want you to come into contact with, so it hid them in your fat cells. And now those things are coming out. You're going to feel a little bit poorly as your body washes them out and eliminates them. And we call this a detox-like reaction. So don't be surprised if you take something, you feel a little bit worse. Okay? Most of those side effects are from something that is good that is happening within your body, but you're probably not even understanding. You're probably thinking, oh, I took it, it made me feel bad, made me feel a little whatever, made me have a little bit of upset stomach or something like that, or I felt, I don't know, I had a little bit of a headache. Those are very typical detox-like reactions. And you're thinking, oh, it doesn't work for me. When in reality, you're on the right therapy. Maybe you're on the right dose and you're going to use it for the right amount of time, but you stopped it early because of these side effects, which were good because it was a sign that your body was eliminating the things that it needed. So be very aware of the side effects. You never want to take anything that you're allergic to or will cause an allergic reaction. Of course, you never want to do anything like that. But there's a big difference between these detox-like side effects and those side effects that come from something like an allergic reaction. So that's number 3, and a really big one. All these are really big, but this one I would say confuses a lot of people. Mostly because they could be on the right therapy, doing the right things, but feeling a little bit poorly, when in reality they're right here. But if they gave it a little bit of time, they would end up to where they were back at optimal health again. So don't forget that. And then the last one would be what I call confounding variables. What does that mean? Well, what I'm referring to is whenever you're doing therapies, you have to think about what is happening in your life right now. Okay, so imagine a scenario where you've heard my videos, you're thinking about doing therapies, let's just say CBD, because that was something that I had a lot of questions on recently. Let's say you're considering doing CBD. So you take CBD and you notice that it doesn't really help you. And maybe you didn't play around with the dose and maybe you didn't give it enough time. Those are all things that could have happened. But other variables can also influence that. And that includes what's happening in your life right now as you're taking it. Are you taking a therapy and then you're going through a divorce? Well, that's going to negate some of the benefits of that particular therapy at that time in your life. But if you take it and just say, oh, well, it didn't work for me because I took it at that point in my life, but you didn't factor that in, really it's something that could have worked for you, but didn't because of the variables in your life. So there are certain things that I've noticed in patients that confound the results that they're getting, and that's why I call those confounding variables. Stress is a big one. And let me just take a step back and talk about thyroid medication while we're here for a second, because I've seen a number of people who will say, hey, I tried this thyroid medication in the past and it didn't work, so I never want to try it again. I'm like, well, tell me more about that. What was the dose? How long were you taking it? What kind of side effects did you have? Did you feel good while you were taking it? And what other variables did you have in your life when you were taking it? All of these things are important if you want to get a clear picture as to whether or not that thing was working. Again, we're focusing mostly on supplements here because those are things within your control. You can just go out and buy those over the counter if you want. And some of them are very powerful. But this also applies to medications. So again, some of these variables would be stress. What's going on in your life right now? Are you giving it a fair shot? Is your dose correct? Is your duration of therapy correct? Are you having a lot of stress, extra stress in your life that you wouldn't otherwise have? That's not a fair playing field. The next one would be certain medications. There are absolutely medications which can impact the effectiveness of the supplements you're taking, and vice versa, by the way. Supplements can impact medications, and medications can impact supplements. But you need to take that into account, especially if you're trying to figure out if it works for you. Another one would be, and here's another big one, would be your weight, your current weight. So I've had people that I've helped lose 50, 60, 70 pounds or more. Obviously, I've had people that have lost 100 pounds, but we're just talking about, let's just say you've lost 10 or 20 pounds, just as an example here. Well, your body, your physiology is different, 20 pounds heavier than it is 20 pounds lighter, which means some of the dose might need to be adjusted, the amount of time that you need to take it might be adjusted, and your physiology has changed as a result of that weight loss. So you have to take that into account. What if you have gained a lot of weight recently? Same thing. You might need a higher dose than normal of whatever it is that you're taking. You might need more CBD because now there's, it needs to be spread throughout your body and it needs to get it to all the cells that it needs to get to, and so on. And then the last one will be genetics. So never forget that your genetics can play a role in the absorption and the utilization and so on. Now this is particularly more, I would say you need to pay more attention to this if you're using medications, not necessarily supplements, but some supplements can be metabolized in different ways due to your genetics. But just keep these things in mind. So we have dose, we have duration of therapy, we have side effects, and we have confounding variables. So I know this was probably a little bit longer than what I normally do, but again, it's so important. And I know it's not flashy, it's not a flashy topic or anything like that, but if you are somebody who is serious about trying to get back your health, these are things that you have to know. I think about all these things every time someone tells me I tried X and it didn't work, or hey, I'm thinking about this, what do you think? And I'm like, I get these kind of questions a lot in comments. And as you can see, it's kind of complicated. So it's not like I can say, hey, yeah, try this or do that or do this. It's like, well, have you used it before? What was your dose? Are you a really sensitive person? Do you also have a lot of autoimmune disease or inflammation or things like that? All of those things affect how you're going to utilize these things. But don't throw the baby out with the bathwater. Give it a fair chance and make sure that you've done these things here so you can account for it. And yes, there might come a time when you look at, you've done all these things, you've given it a shot for 3 months, like let's say LDN or CBD in this case, and you've done it for 3 months, honestly, and you've done all these things, and it didn't work for you. Yes, that does happen, okay? That absolutely can happen, that those things aren't going to work for you. But it is very uncommon, especially as you start doing all these things. You'll start to find, oh, I'm getting incremental improvement. Maybe I should stay on it. Maybe I should increase my dose a little more. All of these things can help you feel better. Now, I want to hear from you. Have you tried these things before? Are you thinking about in your past? Like, what I really want you to do is, as I'm going through this information, think about those therapies which you've tried in the past and think to yourself, did I really give that an honest shot? Is this something that I can reapproach at a later time? And again, a lot of what I do when I talk to people is going back to the therapies that they've done and they've tried and they've thrown it out, but they didn't really know these things, so they didn't give it that honest effort. So if you have, leave a comment below of what you might be thinking about. Do you think that you missed some confounding variables, or do you think you messed around with the duration of therapy or the dose, and maybe you're going to come back to a supplement and see if it works best for you or not? Leave your comment below because I want to hear about it. Also, don't forget, you can download my free thyroid resources. I'll have a link in the description below. You can get all those. I have a bunch of resources which are really helpful for people with thyroid conditions. And otherwise, that's all I have for you, but I'll see you guys in the next one.